Alright, so how we doing, people? My name's Amanda Haynes. I'm from Columbus State University, and today we'll be talking about bedside shift report. So this is just an example of what bedside report should look like. So both the oncoming and the offgoing nurse doing report at the bedside with the patient. So what is shift report? Shift report is basically the transfer of vital patient information between the offgoing nurse and the oncoming nurse. They discuss things like diagnoses, vital signs, labs, past medical history, things of that nature. So there's 4 different types of bedside shift report. You've got written bedside shift report, there's 4 different types of shift report. You've got written report, tape recorded report, which is like super old school, verbal face-to-face, and bedside face-to-face shift report. So why don't more nurses complete face-to-face bedside shift report? And this is an interactive question, so can I get a volunteer?
Okay, all right. I would say a lot of nurses, especially in the morning, don't like to wake patients up to do bedside shift report.
That's a good one. That's actually one that I haven't heard of. That's
Yeah.
a really good one. So there's lots of reasons why. The ultimate issue that we're discussing today is that nurses aren't completing bedside shift report on a consistent basis with every patient. So reasons that that doesn't happen is lack of awareness and skills. So a lot of nurses aren't familiar with how beneficial bedside shift report is for patient outcomes. Also, a lot of them don't really have the skills to be able to interact with the patient doing report, things like that. So another reason that nurses do not utilize bedside shift report consistently is lack of comfort. A lot of times nurses are uncomfortable with questions that patients may have for them regarding their plan of care, things like that, and they're also intimidated. So another reason that nurses do not utilize bedside shift report is unintentional disclosure of information. So basically a patient was diagnosed with cancer and now the nurses know this, but the patient doesn't. And so we've, disclosed this information unintentionally, just trying to be proactive. Another reason would be HIPAA, so privacy concerns. A lot of patients around shift change have family members at the bedside, visitors, things like that. So not wanting to disclose personal patient information in front of visitors. So the number one reason that I found that bedside shift report doesn't occur consistently is because it's time consuming. It takes a lot of time. You go in and a patient asks for ice water, they need to be turned, they need to be toileted, things like that, and it takes more time than it would if you just did report outside the door. Alright, so some more root causes as to why bedside shift report doesn't occur on a consistent basis is lack of nurse buy-in. So a lot of nurses don't really feel that it has any type of effect on patient outcomes, things like that. They just aren't buying into it. So lack of leadership is another root cause. Nurse leaders and nurse managers not really enforcing it or like setting an example for nurses to complete bedside shift report. Also negative nurse feedback, just it being time consuming, things of that nature. And then also the authoritarian approach, which is nurse leaders or nurse managers kind of telling you to do something, and people don't really respond well to that sort of approach. So that's another root cause as to why that doesn't occur. So why is this a problem? Basically, first we've got decreased patient outcomes. Make sure I'm in the video. So there's a lack of knowledge of the plan of care for the patient. When you don't do bedside shift report, the patient's a little more lost and isn't really sure of what we're doing for them. And also increased anxiety because they don't know the plan of care. Patient safety is definitely a big issue as far as decreased patient outcomes. Falls and medication errors occur. So I found this super cool fact that 2/3 of sentinel events that are hospital related are related to communication issues, and that's a large portion of that is accounted to miscommunication. So another issue is reduced nursing effectiveness. So inadequate handoffs. So it's change of shift, and you got your offgoing nurse, and she tells you the patient has a left AC and a right AC, and they're getting NS at 75, and you're doing a report outside of the bed. You don't confirm any of all this, and you go in, and the patient has like a right hand, and they're getting D5 half NS at 5. So there's that inadequate handoff. Also decreased satisfaction. So it has been shown that nurses' job satisfaction is directly related to patient outcomes. So the happier your nurses are, the happier your patients are. So why change? So obviously quality patient care, that's our top concern. Decreasing patient harm goes hand in hand with quality patient care. Also error identification, so being able to go in at the bedside and confirm that what the offgoing nurse has said about this patient is true or accurate. Also effective communication and patient satisfaction, all important reasons. So what's the solution? So in doing my research, I found that this guy, Everett Rogers, created this 5-step approach to initiating and implementing and sustaining bedside shift report. So his 5 steps are knowledge, persuasion, decision, implementation, and confirmation. So knowledge is basically introducing bedside shift report to the unit, to your nurses, letting them know that this is a thing that exists, because a lot of nurses have no clue. And just providing that education, basically reinforcing that it's going to lead to improved patient outcomes. The second phase is going to be persuasion. So basically to establish a favorable attitude with your nurses, letting it be a positive thing and not so much a negative thing or something that's going to be time consuming. Also discuss advantages and disadvantages with the nurses as far as completing bedside shift report. The third phase is going to be decision. So you basically want to encourage staff engagement, get your nurses involved, kind of make it fun for everybody instead of just another chore or just another thing that we have to do in the hospital as nurses. Also encourage innovation and new ideas, make it creative, make this something, again, positive that nurses are going to want to engage in. So the fourth phase is going to be implementation. So we're going to have staff meetings, huddle, things like that. I could not think of that word to save my life. So really talking about it and enforcing it, in those settings. Also positive reinforcement. So you see 2 nurses go into the bedside as a nurse leader or a nurse manager, and complete report at the bedside. Once they come out, give them a pat on the back, like, great job, keep up the good work, this is what we really want. And then the last phase is going to be confirmation. So again, encouraging your employees, continuous positive reinforcement. All of these 5 steps kind of surround the idea of positivity. So more solutions to sustaining bedside shift report with nurses on the unit is going to be education, so modules, things like that, really like enforcing how much of a difference this has on patient outcomes. So reenactments like videos, examples for what bedside shift reports should look like is another solution. Also those daily reminders, so in huddle, really reinforcing like, that we need to do report at the bedside. And then also organizational reinforcement, so having the organization back the idea of bedside shift report and really creating the culture within the community. So my personal obligation and your personal obligation is going to be to set the example, lead by example, you know, be that nurse who's going into each patient's room during bedside shift report, things like that. Encouraging bedside shift report to each nurse. So say you're coming onto your shift and you get this nurse who is getting off, she's ready to go, she doesn't want to be bothered, and she wants to do a report outside the door, you know, just saying, hey, let's step into the room, let's, you know, interact with the patient, things like that, is encouraging other nurses. And then sharing the knowledge, basically, you know, sharing that education, letting them know, improve patient outcomes, all that good stuff. So potential outcomes are going to be that all nurses will complete shift report at the bedside of every patient, every shift. We encourage that the patient be included in the shift report, as well as encouraged to participate as well and kind of give their feedback. So an ultimate outcome would be that patients will experience improved outcomes as evidenced by decreased fall rates. So, you know, you go into that room from that patient, from that nurse, and the nurse said that the patient's a high fall risk, the bed alarm is on, it's low and locked, all 4 side rails are up, and you walk in there and the bed alarm isn't on and the patient's like halfway out the bed. You know, you just decreased your fall rates just by going in and doing a report at the bedside. So that's pretty cool. And then also nurses are going to experience improved job satisfaction. So like I said, the way that patients feel and are treated is correlated directly with nurse job satisfaction. So that's another potential outcome. And then also patients and families will feel more involved with their plan of care, which will ultimately decrease their anxiety, knowing what's going on and what we're doing for them, and not just them sitting in a room getting poked by lab every morning at 4 o'clock. So I figured that a great way for everyone to really get a great idea of what bedside shift report looks like is to show you guys a video, a YouTube video. So let me play this. All right, 2 seconds. Brief intermission. Y'all got internet here, right? I don't think Hunter can see this. What's it called?
I think
CRHS?
It's
Hospira?
No.
Or is the internet?
Yes.
Excuse all that.
Hello, Miss Pendeline. I'm getting.
I don't know how to fix it. I'll tell you what, I'm
Okay,
just
just
gonna
turn
turn
the
this
laptop
around.
around, that's fine.
Yeah.
Ready to go home. This is gonna be your night nurse, and she's gonna take really good care of you tonight.
Hi, good evening, Miss Pendeline. My name is Beverly. I'm gonna be your nurse tonight till 7 in the morning. Can I check your armband? Can you state your name and your birthday? Do you have any allergies? I'm just gonna get a report from you, Miss Lynn.
Okay, so Miss Nydia came to us from the ER. She's a 40-year-old female who was admitted for chest pain. She's had 2 negative troponins so far. Miss Nydia, that means the labs they drew downstairs to check your heart muscle for injury have come back negative so far. So she has a cardiac diet. So you can go ahead and eat your dinner tonight and an NPO after midnight. So nothing by mouth after midnight until tomorrow morning for her stress test. She has a right forearm 20 gauge with normal saline at 75.
I'm gonna check your IV.
Miss Miss Nadia is alert and oriented. She can ambulate with assistance. She did report some dizziness in the ER, so we have a fall wristband on her as well as the yellow socks. So Miss Nadia, if you need to get out of bed or go to the bathroom, just remember to call us and ask for help. She also has been sinus rhythm on the tele. She also has 2 milligrams of morphine available for pain as needed every 4 hours. Miss Nadia, are you having any pain right now? Goals of care include pain management and patient safety. If you don't need anything else, Miss Nadia, your night nurse Beverly will be back every hour until 10 p.m. and every 2 hours after that so you can get some rest.
Miss Brandon, do you have any question, any concern? Just let us know. I'll be checking on you every hour. Nadia, I'm just gonna update your board. I'm gonna put my name down and change your diet to nothing but mouth. Your nursing assistant will be Anne, and our charge nurse is Angela.
So if you need anything else before we come back, Miss Nadia, just hit the call light on the side of your bed. Is there any questions you have?
Who was my cardiologist again?
Dr. Body.
Okay, thank you.
Miss Nadia, would you like the curtain closed for your privacy?
Did you see her check on all right, so that concludes my presentation on bedside shift report. Do y'all have any questions?
No, that was great.
No questions? All right, cool. Well, thank you so much for